It is a feel-good Friday on 92.7 WOBM. Sean and Sue, and joining us, our special guest is Amanda Bitterman, a licensed professional counselor and registered art therapist who is the lead therapist at Robert Wood Johnson University Hospital's Somerset Eating Disorders Program, which is part of the RWJBarnabas Health Behavioral Health Services in partnership with Rutgers University Behavioral Health Care. Good morning, Amanda. Thanks for being with us.
Hi, Amanda.
Good morning. Thanks for having me.
So, Amanda, let's start here. What are the most common types of eating disorders?
Yeah, so there are a few. Obviously, most commonly socially known eating disorder is anorexia nervosa. So this is when individuals restrict food intake, they have intense fear of weight gain, struggle with distorted body image. Then after that, we have bulimia nervosa. So this is where people engage in recurrent episodes of binging, followed by compensatory behaviors. So we see this as vomiting, using laxatives, excessive exercising. And then the most commonly in the United States actually is binge eating disorder. So this is when individuals engage in recurrent episodes of eating large amounts of food in a short period of time, usually then feeling a lack of control.
And what are the signs that someone's having an eating disorder?
Yeah. So again, so many, but it is different for each person. So difference being some are struggling with their weight, right? Body image. Other signs could be physical. So again, we see the difference in weight changes.
Sure.
Others we don't see, right? So more like depression, anxiety, mood changes, dizziness, fatigue, stomach complaints, even dental issues for some people.
Despite their name, eating disorders are not only about food. What are the underlying issues that are associated with eating disorders?
Yeah, so some of the underlying aspects definitely are a little different. So we see, again, depression, anxiety, mood changes. A lot of times it's more so the struggle with internal identity. Difference also being that other individuals, it's more so about like if they experience trauma or something of like family cultural divides and aspects of that nature.
And what are the complications that can arise in an eating disorder if not treated?
Yeah, so not to scare anyone, but there are some like extreme, like severe aspects of having an eating disorder. So these could simply be loss of weight. Others could be heart issues, like muscle weakness, bone loss, constipation problems, abdominal pain.
It really affects a lot, doesn't it? It affects a lot that you probably wouldn't even think of.
Oh, 100%. I think that's why it goes kind of missed in so many people, right? Parents aren't seeing certain signs and symptoms because they're not physical sometimes.
Yeah.
It is more so the internal battle that your body and mind are kind of going through. Especially in adolescence, we're seeing stunted growth, which is unfortunate. Obviously, major cases, death, which is very scary to think about.
Finally, how are eating disorders being treated?
Yeah. So eating disorders are treatable, and obviously the recovery process is hard but possible. So we treat with a multidisciplinary approach, So this involves medical professionals, nutritional counseling, and mental health professionals. So within our RWJ system, on our unit, we have, again, mental health professionals, so therapists, registered dietitians, psychiatrists, nurses, and then other adjunct therapies. So our program's really inclusive in that we have like art therapy, music therapy, occupational therapy. So we all kind of get together and help the individuals with both the physical and emotional aspects.
We want to thank our guest, Amanda Bitterman, talking about eating disorders. Thank you so much, Amanda, for shedding light on this.
Of course. Thanks for having me again.
For more details, you can go to rwjbh.org. It's a Feel Good Friday with Sean and Sue on 92.7 WOBM.